A very good morning, Malabites and Malabresses, ladies and gentlemen, friends and foes, mummies and daddies, aunts and uncles. You are tuned into Unico 103.5 FM, the only station that offers you the best of education, information, and of course, entertainment 360. We love to call it Edu Infotainment. Yes, it is another beautiful Friday morning right here in the beautiful city of Calabar. How are you doing this morning? You can agree with me that Fridays are literally the most anticipated day of the week because, every single person always look forward to Fridays. Because, Fridays is the beginning of the weekend. A lot of us have been working from Monday, Tuesday, Wednesday, Thursday. The weekend is finally here for us to enjoy and, just relax. But before I let you enjoy, the thrill of Friday, the thrill of the weekend, I have something very special for you this morning right here on Unico 103.5 FM. Today is the 25th day in the month of April 2025. A very special day in, World Health. Just in case you do not know what the occasion is today is World Malaria Day. If you're in Nigeria, you know that malaria is something that we literally fight every single day. So today is that day where we set aside to, celebrate World Malaria Day and also look for ways to prevent and control malaria. My name is Vine Henshaw. They call me Spice of the Airwaves, and I'm your host for this amazing session this morning. I have somebody very phenomenal in the studio, and we're going to be having a conversation centered around prevention of malaria. I'm not going to introduce him just yet. I'm going to go on a very short musical break. When we come back, I'm going to tell you who we have in the studio this morning. Do not touch that dial. It's Unico 103.5 FM. Stay locked. 10:06 on the DOT. Welcome back from that short music break. If you're just joining us, it's Unico 103.5 FM, the only station that offers you the best of education, information, and of course, entertainment 360. We love to call it Edu Infotainment. My name remains Van Henshaw behind the MIC. And of course, I told you before the break that, today is World Malaria Day and we have somebody very special in the studio. And together, we're going to be discussing about, malaria holistically. So the person we have in the studio with us is Dr. Ekperone Babatunde Esu. Dr. Esu is the acting head of Department of Public Health Science at the University of Calabar, UNICAL. He is a highly respected public health specialist with a particular focus on epidemiology and international health. Dr. Esu is a senior lecturer in the Epidemiology and Medical Statistics Unit of the Department of Public Health, University of Calabar, Calabar. He has core competencies in clinical trials, survey methods, and project evaluation and evidence synthesis. Over the years, Dr. Esu has been involved in conducting systematic reviews of interventions relevant to maternal and child health, designing studies, and using epidemiological methods to inform intervention aimed at reducing the burden of neglected tropical diseases, including malaria. Dr. Esu holds a Bachelor of Science in Zoology, a Master of Science in Public Health, and a Doctor of Philosophy in International Health. In addition to his academic credentials, Dr. Esu plays a pivotal role in several professional capacities, including serving as the Associate Director of Cochrane, Nigeria, and as a field epidemiologist for the Cross River State's Health and Demographic Surveillance System, CRHDSS, University of Calabar, Calabar. Dr. Esu's academic and research expertise has reflected in over 79 published works. He is a Fellow of the Royal Society for Public Health, FRSPH, a prestigious recognition of his significant contributions to the public health field, a life member of the International Epidemiological Association, IEA, and a member of the International Society of Evidence-Based Healthcare, ISEHC, in Nigeria. He is a member of the Epidemiological Society of Nigeria, EPISON. A unicorn, Dr. Isu is widely respected for his commitment to students' mentorship and academic excellence. As we delve into discussion on how to reinvent to provide I'll take that again. As we delve into discussions on how to reinvent in proven intervention, reimagine our approaches, and reignite the global fight against malaria, there is no better guide than Dr. Isu. Dr. Isu, we are truly honored to have you with us today. Welcome on the show and very good morning to you, sir.
Thank you, Vine. Good morning.
Good morning. How are you feeling today?
Good.
It's such a pleasure to have you, in our midst today, given that you are somebody who is, you have a lot of expertise in this field, the field of public health and, the fight against malaria. Thank you so much for joining us. So, I would love to ask you this, right, before we jump right into it. What gave you the drive to want to venture into public health as, a field?
Also, like many other Nigerians, in most Nigerian homes, there are only three professions.
Okay.
You can guess them.
Absolutely.
It's medicine,
Law and engineering.
Exactly. So I also started down that path.
Okay.
Because I was good in the sciences, I thought then it makes sense to do either medicine or engineering.
Okay.
So, but eventually I found that given the peculiarities of our setting, it makes more impact if you invest in prevention rather than treatment.
Absolutely.
And so that's what has formed or been the drive for my choice for public health, and that has informed all I have done since then.
We're grateful that you chose that path at the end of the day. Once again, welcome on the show. Today is the 25th day in the month of April 2025, and today happens to be World Malaria Day. And this year, the theme says, Malaria ends with us. Reinvest, reimagine, and reignite. How does this theme resonate with you?
Well, over the course of the last 2 decades, we've made tremendous strides in reducing the burden of malaria in terms of reducing number of new infections and also in terms of reducing death and morbidity from malaria. But like the theme says, there's still a lot more work that needs to be done.
Absolutely.
Particularly in sub-Saharan Africa, which still carries the most
highest
significant burden, up to 95%
Absolutely.
of the global malaria burden. So there's still a lot of work to do. The COVID-19 pandemic set us back a bit. But as a result of that, we saw a slight spike in a number of new cases. But on the whole, we've made tremendous progress in preventing death and keeping families out of poverty.
Amazing. Thank you so much. So now let's just, jump right into it. Let's start with the public understanding of malaria. Right. We know malaria is very common, but not everybody fully understands its pathology. For the benefit of our listeners, could you kindly break down what malaria actually is?
Okay, so malaria has been around for a long time. And simply put, it's a parasitic protozoan, which belongs to the genus Plasmodium. And in humans, there are 5 main species that are dangerous. The first being Plasmodium falciparum. We also have Plasmodium vivax. There's Plasmodium malariae, Plasmodium ovale, and then the 5th and most recently discovered species was Plasmodium nulensi, which tends to be predominantly among people who dwell in forested areas. So we suspect that it had crossed from primates like monkeys into humans. So in terms of how it's spread, it's primarily through the bites of a female Anopheles mosquito. And so when the mosquito bites, it's predominantly the females because they need the blood meal to feed their eggs. So it's an existential threat if the female is not able to find blood, because then she can't feed her eggs. So, but the problem is that in this exchange, there is parasites released in exchange for the blood that is taken by the mosquito. So the parasite lives in the mosquito, at some stage in the gut, and at other stages in the reproductive part of the mosquito. So when an infected mosquito bites a human being, it leaves the sporozoids of the malaria parasites in the human. This subsequently moves to the liver, develops into merozoites, and then ultimately spreads from the liver to all of the red blood cells. And when the red blood cells start to break down, that's when the person comes down with all of those symptoms, which we have now come to associate with malaria, like fever, chills, and then weakness. And then because the parasite has broken down the red blood cells, this will cause anemia. And this, if untreated, can ultimately result in death.
Okay, amazing. Thank you so much for that really thorough breakdown. Now, we spoke about fever being one of the common symptoms for malaria. Now, we live in a region where we hold strongly to superstitions, misconceptions, and myth. So, what are some ridiculous misconceptions you've heard about malaria? Because over here, somebody has a little fever, it's malaria. Somebody has a cough, it's malaria. So, in your field and your years of expertise, what has been some of the ridiculous misconceptions you've experienced about malaria?
Well, I won't call them ridiculous. Somehow, we all have reasons for some of the opinions that we form. But some of them I've heard would be that if you walk in the sun for too long, you could get malaria.
If that is not ridiculous, I wonder what it is.
Well, there's a link, because you need to be exposed to mosquitoes to get malaria. So in a sense, maybe people have drawn inferences from being out and exposed to where mosquitoes could bite. So they may not know the mechanism, but all the same, they've made their own inferences. You also hear people who say that you must always treat malaria with typhoid, which is not good for drug resistance, because people end up taking drugs that they may not necessarily need at the time. So when they really need them, the parasites are already accustomed to the medications, and so they don't tend to work anymore. And so there are several myths which also center around the preventive measures that we use. So for instance, some people believe that sleeping under a net, which is white, would bring bad luck, because white cloths are supposed to be to wrap dead people. And some of this feedback has informed why in many countries we now use blue nets instead of white nets. So people have different myths and for different reasons. But as public health experts, our job is to continue to break down these myths so that people understand that they're not true, and then do proper public health engagement so that people begin to change all of these myths and misconceptions about malaria. Because as long as those myths persist, it would hamper our ability to effectively control and ultimately eliminate malaria.
So how have you effectively, educated and addressed this myth of surrounding malaria?
So the Rollback Malaria Initiative, which is facilitated by the World Health Organization, has actually done a lot of work around advocacy and behavior change communication for malaria. So there are jingles on radio, which is one of the widest means of reaching the population in our setting. They also have road shows and plays. We also use posters. And also, again, in educational institutions like ours, we also train nurses, public health scientists, who are also ambassadors in this fight against malaria.
Amazing. Not until today that I knew that, the reason why the blue mosquito net was introduced was because of the misconception people had about the white mosquito net. Anyway, moving forward, let's talk about the Nigeria's burden, right? It's just like you said, right? Nigeria is one of those countries that suffers greatly from mosquitoes and the malaria parasite. I mean, we have over 27% global cases of malaria, and 31% of death worldwide caused by malaria. So, despite decades of investments, Nigeria still carries the world's largest and highest malaria burden. In your expert view, what structure or policy fosters, sorry, I'll take that again. What structures or policy factors are preventing basic malaria prevention efforts from translating into long-term successes?
Well, I would say that we've made a lot of success
Okay.
and progress with controlling malaria. Because we have not attained our targets, we sometimes trying to belittle the progress that we've made.
Okay.
So we've averted millions of deaths, which ultimately means we have more manpower to contribute to the economy. The health system has also saved money now that we spent on treating and caring for patients,
Okay.
which could be used in other sectors that would bring about more sustainable development. But I think the greatest challenge we face is that in ascertaining the predominant vector for malaria is the most efficient in the world.
Okay.
So it's not a case of us not doing what we're supposed to do. It's just that the conditions in terms of the temperature, vegetation,
Okay.
the amount of rainfall is
It's
optimal
convenient for them.
for the vector
Okay.
to breed.
Okay.
And so we still have vast lands that are undeveloped because urban development also reduces the amount of available breeding sites for these mosquitoes.
Okay.
So yeah, like I said, we've made progress, but of course there are still challenges. So some of them would be insufficient funding.
Okay.
We pledged to support health with up to 15% of our annual budget. But even up to 2025, we're still under 5%. So in the 2025 budget, we have about 2.83 trillion,
Okay.
which is about slightly under 4%, 3 point something percent. So we're still a long way from the 15% which we had pledged and committed to achieving.
Okay, amazing. So we cannot talk about the prevention and control of malaria without talking about our healthcare system in Nigeria. You've worked with global partners like World Health Organization and Cochrane. How would you assess the current quality of malaria case management in Nigeria's healthcare system at various levels, from the primary healthcare, secondary healthcare, and tertiary healthcare?
So thanks to our global partners like the Global Fund and the Bill and Melinda Gates Foundation, we have received lots of support to make commodities for diagnosis as rapid diagnostic test kits.
Okay.
And in many cases, they've built capacity for undertaking microscopy. But in rural areas where electricity is a problem, the mainstay for diagnosis remains rapid diagnostic test kits. So these have been rolled out across the country, and in many states, all cases of malaria are confirmed through an RDT test or microscopy, and then, if positive, treatment with ACTs, which are also provided through donor support, is provided to patients.
Okay.
Well, we also have stockouts occasionally. So in such instances, people who need the medicines may not be able to get the medicines.
Okay.
We also have hard to reach areas where there are no accessible roads, or you have to go by water. So this also affects the quality of care that patients receive in those settings. But overall, with the support of donors, we've been able to make significant progress in scaling up some of these interventions. And then on the prevention side, we also have been doing mass campaigns for the distribution of long-lasting insecticide-treated nets.
Okay.
So those have really helped.
Okay, you've spoken about donors, foreign donors a lot, but how about locally, right here in Nigeria? Do we have people that are, invested in ensuring that, malaria is controlled and may be eliminated?
Yeah, so we have some foundations in Nigeria that have been supporting health interventions.
Okay.
One is the Dangote Foundation.
Okay.
They have given a lot of support to health.
Mm-hmm.
And then following the COVID pandemic, we also had a coalition of private sector players who came together to pledge funds to battle COVID, but also to strengthen the health system.
Mm.
So, but the proportion of homegrown funding for health
to foreign
is still
funding.
Very little compared
to the foreign funding.
The foreign supports we get.
Okay.
And in the face of the changes in the American administration and its approach towards donor funding, we really need to look inwards to be able to combat malaria in the days ahead.
Okay, thank you. You spoke about the U.S. New approach. So how has that affected the funding from the international donors?
So for Nigeria, we still have support from the Global Fund.
Okay.
The Global Fund for Malaria, Tuberculosis, and HIV and AIDS.
Okay.
So we haven't totally lost all funding.
Okay.
So at least for the next 2 years, we have funding to cover most of the consumables we need. But after that, before that runs out, we need to start thinking inwards of ways we could fill the gap that the freeze on USAID funding from the US would create. Already, several programs have had to stop implementation immediately.
Yes.
And others have had to scale back. So we'll watch and see if it's a temporary ban on support or if it's a long-term ban.
Fingers
if
crossed.
It's a long-term ban, then there are other innovative approaches that we could exploit to fund healthcare and malaria control and elimination in particular.
Amazing. Thank God you spoke about elimination. So let's look at that now, elimination versus control. From a public health planning perspective, what should a wise government aim for? Elimination or sustained control of malaria?
Yeah, so for a wise government, it would be elimination.
Okay.
But just to clarify that there's no way you can get to elimination without first sustainably controlling the spread.
Okay.
So it's a spectrum.
Okay.
With control being at one end and the ultimate goal being elimination.
Okay. So let's look at the Nigerian context. What would it realistically take? Sorry, I'll take that again. Let's look at the Nigerian context. What would it realistically take to make the goal achievable from a cost effectiveness and sustainability standpoint?
Well, so like I said earlier, the problem we have in our setting is that we have a very efficient vector.
Okay.
So we need to invest in vector control because once we're able to prevent infected mosquitoes from reaching humans, then we have successfully prevented transmission.
Okay.
The unique thing about malaria is human beings are the host, but we can't take out all the humans. So we've tried to intervene in other parts in the life cycle.
Okay.
So if we're able to contain the vector, it would go a long way in advancing our goals of elimination.
Okay.
But first, we need to substantially prevent mosquitoes from getting in contact with humans. And for now, the best tools we have are the use of insecticide-treated nets, particularly my children under 5 and pregnant women who are the most vulnerable group. But let's not forget that malaria can infect everyone. So some people have forgotten that and tend to think it's a problem for only under fives and pregnant women. So those are the most vulnerable groups.
Yes.
And then also people who are immunosuppressed, either because of HIV and AIDS or any other infection that could compromise their immunity. So they are also a vulnerable group. But let's not forget that everybody is
prone
at
to
risk malaria.
Okay, you spoke about insecticide-treated nets as a preventive approach to malaria. So I wanted to ask this question. I mean, it's based off popular opinion. Do you think it's healthy to sleep under insecticide nets and use insecticide at the same time?
When you say at the same time, you're not supposed to be in a room right after you have used insecticides. You're supposed to close all the windows and then allow maybe up to 30 or 45 minutes. And come back, air the room before you.
You have to air the room before you sleep in it.
You have to air the room. Don't forget the insecticides are targeting mosquitoes, not human beings. So you're not supposed to sleep in a room that still has insecticide fumes.
But if you do them the right way, you can actually use both of them.
Yes. And then also the net too is impregnated with insecticide as well, which from time to time need to be retreated. But if we assume that it's a newly treated insecticide treated net, once you've aired the new net, because you're supposed to air the net before you use it, then the net itself already is impregnated with insecticide treated with insecticides. So you may not necessarily need to also spray insecticides in the house.
It's not necessary.
Yeah.
So how often do you change the insecticide treated mosquito nets?
So the first indication will be if it has holes.
Yeah,
and then that depends on the wear and tear of the net. And the other factor would be what kind of insecticide was used to treat the net. And so different insecticides have different validity periods. So this is based on the manufacturer's specifications.
Okay. Amazing. Anyway, so Unico 103.5 FM, the only station that offers you the best of education, information, and of course, entertainment 360. We love to call it Edu Infotainment. Time check is 32 minutes past hour of 10, and we're still here in the studio with Dr. Isu, and we're discussing the prevention and elimination of malaria. Today is World Malaria Day, and the theme says, Malaria ends with us. Reinvest, Reimagine, and Reignite. We're going to go on a very short music break. When we come back, we're going to have conversations centered around the malaria vaccine. Do not go anywhere. It's your Unico 103.5 FM. That was beautiful by Spiral. Welcome back from that short music break. If you're just joining us, it's Unico 103.5 FM, the only station that offers you the best of education, information, and of course, entertainment 360. We love to call it Edu Infotainment. Time check is 10:36 on the DOT, and we're still here, with Dr. Isu, who is a public health specialist, and we're talking about malaria prevention and possibly elimination. So far, so good. He has been insightful. He has been nothing short of amazing. So, Dr. Isu, let's go back into the conversation. Now, we've spoken about eradication, control, and all of that. Now, let's talk about the malaria vaccine, the R21. That's the second malaria vaccine after the RTS. With the R21 malaria vaccine now being introduced in some Nigerian states, what lessons should we take from past immunization campaigns to ensure this rollout is effective, equitable, and scalable across the country?
So the first thing about vaccines we know is that people are usually hesitant. But the hesitancy is as a result of previous experiences with other vaccines. So we need to do a good job of community engagement through community leaders and also religious leaders. We need to set up robust data monitoring systems so that we can track coverage of the vaccines and also, very importantly, where adverse events occur, we need to document them. Because this will be the source for rumors that would make people hesitant with receiving the vaccine. We also need to continue to improve on our cold chain for storing vaccines. Luckily, this is not the first vaccine that we will be rolling out, and we will need to leverage on the already existing logistic and supply chain for storage, while also expanding to areas that may necessarily not have. The other good thing is that it's a phased approach. So we started in 2 states, Kebbi and Bayelsa, which are 2 states that have
the
the
highest cases.
And so if we do a phased approach, we're likely to get it right, as opposed to trying to implement it in all 36 states and the FCT at the same time.
Okay, amazing. Okay, so the R21 vaccine is primarily made for children aged 5 years to 36 months, if I'm not mistaken.
Yes.
So can adults also, take this malaria vaccine, the R21 vaccine?
Yes, so because it's a phased and targeted approach, the priority is given to the most at-risk groups.
The vulnerable.
Yeah, so that's why the focus is currently on under 5s. Because they are in the most need of these vaccines, because malaria infection gives you some immunity, although it wanes over time. So for most adults who are living in an endemic area, they will have built some form of partial immunity. But we need those under 5s to catch up to where the adults are already at in terms of immunity. So that's why the priority is currently given to under 5s.
Okay, amazing. So let's move over to domestic funding. How can Nigeria improve domestic financing mechanism to reduce its reliance on international donors and ensure long-term sustainability of its malaria elimination efforts?
So in the last few years, we've seen some innovative taxes introduced. So we have a cyber security tax. We have other stamp duties and charges on every transaction. So all of these monies could be channeled towards health and specifically malaria elimination. So it will also help to set up a dedicated malaria elimination fund, because in health there are several competing priorities. So it might not be enough to have funds dedicated to health. Remember earlier I said we had committed to spend 15% of our annual budget on health, but we're not yet at 5%. So all the health interests have to be catered for in that less than 5%. So if we want to make huge leaps towards elimination, we will need to have a dedicated fund for malaria. And this means we need to build political will. Politicians and policymakers need to recognize malaria elimination as something that would be beneficial to the economy and also to the society.
To the country,
because of all the savings we can potentially make from diagnostic tests, vector control interventions, and also ACTs that we need to treat malaria. So we need to see it as something that is beneficial to everyone, and then hopefully we will now prioritize funding for this malaria elimination effort.
Amazing. So let's talk about community-led innovations. If you were to build a community-led malaria program from scratch, what would be its core component, and how would you ensure that it is inclusive, sustainable, and locally driven?
So luckily, I don't need to build from scratch. Because we already have a lot of work that's been done. So currently, the ACSM approach has driven how we go about community-led engagement. So it stands for advocacy, communication, and social mobilization. So in several communities, including in Cross River State, there are ACSM committees that help bridge the gap between community and government to engage, and that's how we've been able to identify some of the myths around malaria. So they do road shows, they go to schools, they do jingles, And there is also a national strategic plan for behavior change communication around malaria and also for other diseases.
Okay.
So the key thing is to involve communities from when you conceive the ideas, not when you are ready to implement interventions.
Okay.
Because you need to get that buy-in from the foundations when you plan these programs, not when you are ready to implement.
Okay.
So once we continue to consult and collaborate and co-create with the communities, then we'll make better progress.
Okay, you said two things that caught my attention. You spoke about community and advocacy. Now, the university is a community. How has your initiative, innovation, helped to create some kind of awareness and advocacy for malaria in the university community?
Okay, so in the past, we have always been part of the World Malaria Day walk. There's usually a walk.
Okay.
This year, it's being flagged off in ICOM.
Okay.
And on Wednesday, there was a symposium organized by the state's malaria elimination program.
Okay.
And I was part of the panel discussion. So advocacy is about reaching out and continuing to communicate, and we've been doing that. But more importantly, in our daily lives, there are little things that we could do to also drive home this message. Like we said, malaria ends with us.
Yes.
So there's something each and every one of us can do.
Can contribute.
That bottle of water that you throw in the gutter, you may not see the link between it and malaria, but if everybody throws one bottle, eventually it clogs the drains and it holds water, which becomes a breeding site for mosquitoes.
Yes.
So there are several things we can all do that will ultimately contribute to eliminating malaria.
Amazing. So lastly, let's reflect, on what we've spoken about. Now, if we had all the tools and fundings needed tomorrow, but malaria still persists, what human or behavioral factors do you think still stands in the way, and how can we begin to address them today?
Sadly, we don't have all of the funds.
Oh, that's that's one side of the coin. Yes.
Assuming we did, it would be down to human behavior.
Okay.
Like I said, humans are the host. If it was ethical and possible, we would take out all the humans and malaria would be gone. But we can't do that. So we would continue to appeal to people's conscience to change behavior.
Okay.
If everyone slept under an insecticide-treated net for a month or two,
okay,
that would go a long way. But for various reasons, for some people, because of their occupation, spend a lot of time outdoors, so it may not be practical to say that they sleep under a net all the time.
Okay.
And another thing we are forgetting is that the mosquitoes have always stayed ahead of us. So they also continue to evolve.
Okay.
They also change their biting patterns. In some areas, they bite predominantly indoors. In other places, it's predominantly outdoors. And in some cases, the mosquitoes bite both humans and animals. So as we try to evolve new strategies, the mosquitoes also
evolving.
So if we don't succeed, it's probably because the mosquitoes have stayed ahead of us.
Okay, thank you so much, Dr. Isu, for that insight. So before I let you go, let's talk about let's educate the general public, because this is a campus radio and we have a lot of students listening. So how often should people get tested for malaria?
So every time you have a fever, you should go to a health facility to get tested. Like we said earlier, fever is not equal to malaria. So there are several other diseases and infections that could present with fever. And so you should get tested and only treat if the test comes out positive for malaria.
Okay, and do not self-medicate as well, because I think that's one thing that is very, very, very common with young people and even older people, right? When once you have a fever, or let's say your test result comes out positive and you take laws into your hands and you get something, the usual that you always get during your down days when you have malaria. So self-medication is something that should be addressed.
Yes.
Advocacy should be done, in regards to self-medication, because there are a lot of dangers that could result from self-medication. Anyway, it has been an insightful discussion with Dr. Isu, who is a public health specialist, and we're talking about malaria, how to prevent malaria, and possibly how to eliminate malaria. So Dr. Isu, before we go, what are your last words?
Well, like we say, it's World Malaria Day. We need to re-strategize. We need to reignite the passion which seems to have waned for eliminating malaria. We need to innovate because, like I said, the mosquitoes for how many decades now have found a way to keep evolving and have stayed relevant. So we also need to begin to be more innovative in our approaches. And by all means, we need to scale up vector control interventions, because this is the only way we can keep the vector, which is the mosquitoes, away from humans, because no mosquito bites, no malaria.
Amazing. And just like you said, there's something that every single one of us can do in order to, prevent the spread of malaria. You might not know this, but there's something you can do. All of us, if we come together, to do something, we are not going to have malaria at the end of the day. So there's something that every single one of you can do. Anyway, World Malaria Day reminds us that the fight against malaria is far from over, but it is within our reach. With the right tools, knowledge, and partnerships, we can create a malaria-free world, starting with us, just like, the theme this year says. As we embrace the theme, malaria ends with us. Let's commit to reinvesting in what works, reimagining our strategies, and reigniting efforts to eliminate malaria once and for all. At the time to act now. Together, we can make a lasting impact. It has been such an insightful discussion with Dr. Isu. Join us for more amazing programs lined up for you right here on 103.5 FM, because we bring you education, information, and of course, entertainment 360. Remember, malaria ends with us. Good morning and have an amazing day ahead. My name remains Vine Henshaw. Stay locked for other amazing programs coming up right here on 103.5 FM.